Well, tick numbers have grown 10 times over the past 2 decades, and there have been a rise in reports of Lyme disease across Canada. Now, experts are warning a more serious tick-borne disease may be emerging. The Powassan virus is more rare and more deadly than the bacteria that causes Lyme disease, and numbers are on the rise across the U.S., with most cases coming from the Northeast and the Great Lakes region. Joining me now in the studio is Dr. Gilmour. He's the Scientific Director General of Public Health Agency of Canada's National Microbiology Laboratory. That is a mouthful. Thank you for being here, Doctor.
Glad to be here, Ben.
Okay, the Powassan virus, what is it and how is it different from Lyme disease?
So just as you said, it's a virus that's carried in ticks, whether it's the groundhog tick, whether it's the deer tick. But thankfully, it's actually in very few ticks. We've done a lot of testing of ticks. We've tested thousands of them, and we've only found a handful of ticks that actually carry this virus. But in those cases where someone does encounter a tick and the tick bites them, there is a chance that it could actually transmit and then infect that person. An infection with Powassan actually starts out kind of general. One may actually have no symptoms whatsoever, or they might move off to something like a fever or a headache, and then from there, in a few cases, you can actually move off to more severe symptoms, like you can get dizziness, you can get difficulty in speaking, you might even get seizures, and very rarely, actually, some people do pass away from a Powassan virus infection.
Do we know the rate of illness as it relates to tick bites? I mean, how many tick bites turn into an illness?
So in Canada, we know of about 25 cases of Powassan virus infection, and that's since the 1950s. Actually, Powassan virus is named after a town here in Ontario. So the very first case was unfortunately a young boy in Powassan that came down with the virus and passed away. But since 1958, we only know of about 25 cases here in Canada. And in the States, it's about 75 cases. So it's not a great number. And that's one of those differences with Lyme disease, because in comparison, last year alone, there was about 800 cases of Lyme disease in Canada.
Okay, so we've got a board up right now of some of the differences between Powassan and Lyme. And you can see one of the things that frightens me from this is that the Powassan can be transmitted from tick to human 15 minutes versus 24 hours to transmit from tick to human. Is that one of the scary things? I mean, why are we so worried about this right now if the numbers are as small as you're saying?
Yeah, that's one of the benefits with Lyme, is that if there is an event where a tick actually does attach to you and bite you, you got a good deal of time to actually remove it. So one of the best ways to prevent Lyme disease, well, first and foremost, is to avoid getting bitten by a tick. But if you are out in forested areas or wooded areas, as soon as you're back home, check to make sure that there's ticks from hair down to toes, and just remove any ticks that might be there. So obviously with Powassan virus, if there is an attachment event, you do want to get it off as swiftly as possible. But again, the best measure is to avoid even getting bitten in the first place. So use like insect repellent, wear long pants if you're out on a hike. If you live in an area where there happens to be ticks, think just like taking good care of your yard, like mowing your lawn, keeping the leaves up. Those are good measures to kind of keep the ticks kind of away from where you're just kind of living.
I know that the numbers, as we said, are still low, but are we worried that this could be something that we might not be able to control or could get out of control?
Well, again, we've tested thousands of ticks, whether it's groundhog ticks, whether it's deer ticks, and we've only found a very small number of these ticks that actually have the virus. So that's good news. So if anyone does find a tick on them, the chance of it actually having the virus or the chance of it having Lyme is quite low. But of course, watch out. Monitor yourself for any symptoms, and if you're moving off to things like fever, like headache, that's where you want to visit your doctor anyways. So. And
you want to make sure, if you want to identify that you had a tick attached to you, because otherwise, those symptoms, you could just assume that you have a headache.
Yeah, so when I go camping with my kids, every night when we get back,
we have an image of what the rash looks like.
Yeah, so that's a bullseye rash for Lyme disease. So that would be one of the telltale signs that maybe you did have a tick bite, and that would be a sign to visit your physician there.
Absolutely. Well, thank you so much for being here, Doctor. We appreciate it. And for more information, you can visit our website at yourmorning.ca.